So breast reduction is a sensitive issue for a lot of patients and they want optimized healing after the procedure. So in this video, I'm going to talk about what precautions the patients can take so that they can have optimized healing. Hello, I'm Dr. Arjun Honda, plastic surgeon at Handa Aesthetics. After breast reduction surgery, normally we discharge the patient the same day because the procedure is relatively painless and it takes around 3 to 4 hours to do, another couple of hours for the patient to recover from anesthesia, and they're good to go. Now, because it is associated with moderate to less intensity of pain, they can return back to work next day or day after, depending upon the type of work they do. If it's an office job, then they can go 2 days after. If it requires field work and for them to move around and lift weights, then I would suggest a rest of about a week. But during this period, when the wounds are healing, there are certain things the patients can do to make sure that their healing is optimized. The number one thing is to maintain hygiene because we don't want the wounds to get infected. So, how to do that is to keep yourself clean. Do not go into environments which are humid and which will make you sweat. And also keep a dry and a wet towel ready by your side so that you can clean and dry yourself whenever you have the chance. The second thing is to eat a good diet. Eat a high protein diet, lots of vitamin C, lots of fruits so that the healing is promoted. Do not smoke or drink because that greatly impedes the healing, and also the flaps can go for necrosis if you are smoking because in breast reduction surgery we have to create certain flaps to reduce the tissue and then suture everything back. So we want optimized healing of those flaps, and if any kind of vasoconstriction occurs because of smoking, the healing is going to be affected. The third thing patient can do is to be mobile. You don't have to exercise, you don't have to be exerting yourself, but to remain mobile so that the circulation keeps on going on. So I advise my patients to sleep only during the night, walk a lot during the day, carry out on your daily activities. Do not limit your activity because that will lead to stiffening of the area and can lead to problems. Finally, wear the supportive garment that we've advised you to wear. Now, that supports the tissues unless they heal completely. Normally, I advise a compulsory wearing of the garment for at least 2 weeks, after which the patients can wear it off and on for another week. But those 2 weeks are critical to ensure that the breast heals properly.